Yeah, my name is Hoyen. I'm a consultant psychiatrist, and I'd like to present a paper by Sujita Kumar Kar, who is editor of the Journal of Global Psychiatry Archives. And it's about the socio-economic burden of disability linked with mental health problems. And it's the observation from the National Mental Health Survey of India in Uttar Pradesh. And the study examined a stratified random sample of 3,500 adults who were initially interviewed, and 282 of them had a lifetime prevalence of mental health problems. And there were disabilities in different areas: work, family life, and social setting. And I'd like to come to the results, which some of them are negative to some extent, not negative. So this is what the flow diagram showing the recruitment of participants with mental health problems. And so there are 3,500 people from the community, 282 having mental health problems, and then many of them having disabilities in the work domain, in the family life, and in social life. There were some variables which were looked at. So there are different types and severities of mental disorder, and the types of disability, but what couldn't be found was much relationship between these work-related issues and common mental disorders. So quite a few people had family home responsibility, which were then disturbed, or social life. So it's a bit difficult to see this table in a couple of seconds, but there's an opportunity to watch or to get the information about where to read these papers. Okay, so gender differences in disability in different groups didn't play a role, at least wasn't associated with mental health problems. So there wasn't any association. There wasn't any clear association between specific mental health problems or severity of mental health problems with the urbanicity, so whether people lived in more urban or non-urban areas. Then income wasn't a major difference influencing the outcome or being related to psychiatric morbidity or the type of disability. Right, this is a study seeing how many people who had any problems, then having different types of mental health problems. So that's a percentage of individuals. There wasn't big association between the mental morbidity and the disability severity. So although some of the people with highest severe mental disorder had higher mental disability and had also a different, or had some differences in suicidality, which in my view didn't reach significance. Right, but this is possibly more of the most informative studies of the data, that people with any psychiatric morbidity had 14 days off in the past months, so not working, which is quite a lot. Many days cutting back on working in the past months, reduced work in the past months, so that was possibly people with severe mental disorders didn't work that much, so it's possibly more difficult to reduce. And so how many days were family members not able to work? That was highest in the people with severe mental disorders. And did family miss any social activities? And certainly people with severe mental disorders had family members who missed social activities. And the expenses for mental health problems was highest in people with severest mental disorders. Right, that's how it. That's the data at the moment, and I hope you enjoyed this little overview. And if you liked it, please take liked, or if you want to have more information on the mental health problems that are published in Global Psychiatry Archives, please subscribe to our YouTube channel, Global Psychiatry Archives. And if you want to read any of the papers, please check www.globalpsychiatryarchives. That's a journal. If you want to see any on the website is www.globalpsychiatry.co.uk. Sorry for this mistake. And if you need any clarification, please check the website of the journal. Thanks a lot, and thanks for your interest. And yeah, I hope it was clear now. Thank you.